Well, thank you, everybody, for coming. The physicians and the other scientists making this presentation today are members of the following organizations: the Utah Physicians for a Healthy Environment, the faculty of the University of Utah Medical School, Utah State University, and the Utah Medical Association. We're here today out of concern that public health in Utah and the health of our individual patients are being impacted by climate change and will be even more so in the future. This adds an entirely new dimension to the urgency of addressing this evolving global crisis. Good afternoon. I'm Ingrid Nygaard. I'm a professor in the Department of OBGYN here at the university. And I'd like to tell you about an article recently written in The Lancet, one of the world's most prestigious medical journals. This article, written by 29 distinguished scientists, called "The Climate Consequences of the Greenhouse Gas Phenomenon, the Biggest Global Health Threat of the 21st Century," that will put the lives and well-being of billions of people at increased risk. The report goes on to state that even the most conservative estimates are profoundly disturbing and demand action. The author said that health professionals have come late to this debate, but what is needed now is a public health movement that frames the threat of the climate crisis for humankind as a health issue. And we intend to start that in the state of Utah today. Let me first outline our message today, and then each person on the panel will give more details elaborating on these points of emphasis. The scientific organizations throughout the world are in agreement that we have entered into the early stages of a climate crisis, the driving force of which is primarily man-made. The scientific evidence for this is just as unassailable as the evidence that smoking causes cancer. Second, the climate disturbances will include not just hotter temperatures, but greater extremes of weather, especially drought and severe disruptions of the ecosystems that support the human population. Utah will see average temperatures as much as 10 degrees hotter by the year 2100. Third, global public health consequences will be unprecedented and threaten the lives and health of billions of people, with as much as 30% of the world's population becoming climate refugees. Although poorer countries will be affected the most, no country will be spared, and Utah will not be spared. Fourth, worldwide food production and food security are already under severe stress and almost certain to become much worse as the climate crisis deepens. Utah will be secondarily affected by increased commodity prices and by climate-caused geopolitical destabilization that our own federal intelligence agencies acknowledge represents the greatest future security threat to this country. And finally, these climate disturbances will have direct, predictable impacts on public health in Utah, including more air pollution, more heat-related illness, more frequent and intense dust storms, more vector-borne and other infectious diseases, and more exposure to mercury contamination. Lastly, we'll talk about how Utahns should respond and offer specific recommendations for state government action.